Now let's talk a little bit about why you mentioned for the women, African American women, why it's such a issue.
Breast cancer is the most common cancer among African American women.
Okay.
We have a lower incidence of breast cancer among compared to white women, but we die more often of breast cancer. And we also, breast cancer is the second most common cause of death for African American women. Lung cancer surpasses breast cancer as the #1 cause of death among African American women among the cancers, but breast cancer is the second common cause of death in African American women. And so we really have to understand our risk.
Okay, let's talk about that. Yes, absolutely.
Well, one of the things that we had discussed as a group, that it's very important that we understand that breast cancer is not necessarily found as a lump.
Okay.
There's various signs of breast cancer. It could be on the surface of your breast. It could be a dimple. It could be a number of things, discharge, orange peel. Sometimes that get misdiagnosed.
Okay.
And so we have to really understand that if you see any changes in your breast, and to be very conscious of your breast health, and to contact the doctor. Any symptoms, any signs. And often black women are misdiagnosed. We also get late stage. We tend to have a more aggressive form of breast cancer. And we also have this type of breast cancer called triple negative. And it's one of those breast cancers where it can't be treated with anti-estrogen blocking medication. A lot of breast cancer survivors are on tamoxifen or Aromidase or something like that.
Okay.
But it's, and those women can take this drug and increase their 5-year survival rate. But women with triple negative have to rely on clinical trials, and they still really haven't determined how to treat that effectively. So
32% of the women who get triple negative get cancer back within 3 years.
Okay, now what's this triple negative? What does that mean? Is it 3 times worse or something? Okay.
The receptors. I mean, it has to do with your estrogen, your progesterone receptors. So, I mean, you can expand, because I didn't have that. I had something, mine was a little bit different, so I'm not as informative about that as Ms. Kim.
Okay, go ahead, Ms. Kim, please.
Triple negative, like she was saying, it's a negative kind of hormone, and I'm like ER positive and PR positive and HR2 positive. Women who are triple negative have negative ER and negative PR, and so they have
negative
to
estrogen.
And
I'm a triple negative, so that means they're not positive with those other 3.
Okay.
They're negative, so they're triple negative. That's what they call it.
And it means that you have. I can take like a tamoxifen that will help block the growth of estrogen, because estrogen fuels breast cancer cells. And so this medicine that I take will help stop that the growth of the production of estrogen, and so it doesn't cling onto your healthy cells and fuel breast cancer, because estrogen it kind of gives breast cancer cells energy, where women who are triple negative, they don't have this kind of treatment plan, and a lot of them are relying on clinical trials and different dietary.
Like how there's no cure for breast cancer, that's even a more aggressive form of, as far as being treated and things of that nature.
Okay, so go ahead and speak to that a little bit.
Well, I mean, I can speak to because I was HER2 positive with that, which that also is the cancer cells reproduce very quickly. So when you're HER2 positive, you have to take, hopefully you can take, I was lucky to take a medication for a year called Herceptin.
Yes.
And right now, like she said, I'm finished with chemotherapy. I've had all of my surgeries, had my double mastectomy, which that was by choice. And my doctor is looking into wanting me to take tamoxifen. But it's a choice, obviously, up to the patient, to the survivor. And right now, I just don't feel like my God has told me I need to worry about doing that. So, you know, that's my choice. I was premenopausal while going through chemo and stuff like that. I did not have that menstrual cycle, but and my doctor said that that may not happen. They may not come back, and all that has to do with also your receptor cells and that stuff. So part of another reason why I decided not to. I'm just not at this time.
And one of the unique things with Tamika, that she's a young survivor.
Okay.
And we're noticing.
Okay. She's a young survivor. Okay, really, what does that mean for us?
Her age.
I was 36 when I was diagnosed.
Okay.
Yeah, I had no health issues. I worked out, conscious of my eating, doesn't run in my family, and breast cancer, 36.
36, okay.
Very young.
Very young.
And we're finding that more and more cases of young women, especially African American women, are getting breast cancer at a younger age.
Now, is it an age that young women should start having, what is it, mammograms?
Mammograms. The age is 40, but those who have history in their family, they start earlier. When I say history in the family, the mother, grandmother, aunt, sisters, you know, someone might have it. They may start earlier or get it done more frequently.
Okay, now